I'm Dr. Gladys Kalema-Zikusoka, founder and chief executive officer of Conservation Through Public Health, which is a grassroots NGO based in Uganda. We've decided to be part of the Healthy Parks, Healthy People Congress because when I first got the invitation from John Senior of Parks Victoria, the name just jumped out at me because I realized that we're doing something very similar. It's just exactly what we're doing in Uganda. So that's why I felt it was very important to come to the Congress and share our experiences and learn from other people who are trying to implement the concept, maybe in a different way, but I thought it would be a very good way to learn from other people. I'm here to share the work that we're doing in Uganda, why we started to look at things in that way, from a Healthy Parks, Healthy People perspective, and the work that we're doing. I mean, we decided to look at it that way because we had skin disease in the wildlife, the critically endangered mountain gorillas. We had scabies, which was traced to people living around the national park who have very little health care and education and information on health and hygiene practices. And we realized that we could not protect the wildlife without thinking about the people living around the parks who have very little health care. And we realized that if we don't think about them, then we'll never be able to comprehensively protect the wildlife. What I'm hoping to take away from the conference is how to find other ways of promoting healthy parks, healthy people. Yeah. One way is to build on what we're already doing in Uganda, and then also find a way of looking for partnerships in order to promote this concept. Because there are a number of very different and interesting presentations, and it would be very good to be able to build partnerships so that it becomes a move which can go beyond Australia or Uganda to other countries around the world. I'm actually interested in a session of which we're already doing this kind of work, which is the Population Health and Environment session. I think it's on tomorrow morning. The reason why is I want to see how they present everything in the context of the Healthy Parks, Healthy People. Because I know that there's a large emphasis on urban, the need for people to connect with nature. And actually in the last session that we're in to do with Nepal, they brought up a few areas of, yes, this is the problem in the rural areas, but also there's a problem in the urban areas. And I think that also applies very much to Uganda, where the government's cutting down trees in the capital city, which is terrible. And people there's lots of rubbish, lots of plastic bags everywhere. And I think the policymakers who live in the capital city need to understand the importance of nature before they can even protect or put nature conservation on top of the environment, on top of the agenda of the country. So we really need to get them to connect and understand what's going on in the nature. Healthy parks, healthy people to me means that in order for us to have healthy parks, we need to have healthy people. And in order to have healthy people, we also need to have healthy parks. And the reason why you need healthy parks for healthy people is, at least in the case of Uganda, if people are sick, they can make the wildlife sick. And also the wildlife can make the people sick. And if the wildlife is sick, then we no longer get a sustainable source of ecotourism income, which will then sustain the livelihoods of the people around the park. And in improving their livelihoods, health and well-being, then they will be motivated to protect the park because they know that it's the park that's bringing them all these benefits. So I think it's a very tight link between the parks and the people. Globally, to spread the Healthy Parks, Healthy People philosophy, I think conferences like this are very important because we're able to share ideas, experiences, and build partnerships. And I think in building partnerships, we'll be able to build a force for advocacy, which will eventually affect the policymakers, not only just at a local level or a national level or a regional level, but at a global level. For example, in the last session, they talked about the Millennium Development Goals and how the Millennium Development Goals are not really they don't address adequately biodiversity conservation or the links between conservation and public health, or healthy parks and healthy people. So we need to be able to sit here in a group with everybody to be able to come up with recommendations which then can help to shape the Millennium Development Goals, which is really the Bible for a lot of development issues around the world. My hopes for the future are that there will be more and more recognition about the links between healthy parks and healthy people, and that there will be more resources given to people who live around protected areas, because they tend to be the poorest people who have very little services and live in very remote areas. I was just on the aeroplane flying in from Uganda to Melbourne. I watched on Cathay Pacific had a video documentary on people volunteering in Nepal, and they were building a school. It took them 4 days to walk to get to that school. And these people had never seen any Westerners in their lives. And I just realized that if resources could come to people like that and they become a focus, then that would be great. Those are my hopes for the future. Because at the moment, the resources start in the urban areas, and then maybe if there's anything left, it will get to the communities that border the park. But they should now become a priority, because in improving their livelihoods and their health, you're promoting the parks, and then the parks can give a lot more back to the country on a national perspective. And I also believe that the national parks themselves, the conservation donors, should be able to give resources to improve the health of the people who live around the protected areas.